In this video, we're going to discuss the key signs that your knee injury is a meniscus tear. Hey guys, Dr. Andrew here with the Charlotte Athlete, where we are committed to helping athletes quickly recover from injuries so they can move better and continue to be active in their sports. Now in today's video, we're going to dive deep into the key signs and symptoms of a meniscus tear of the knee. And stick around all the way to the end, where I'm going to give you my thoughts and recommendations on what to do if you have been diagnosed with a meniscus tear via MRI and there are whispers of surgery. All right, first things first, what is a meniscus? The meniscus is a C-shaped type of cartilage that rests between your femur, upper leg bone, your tibia, lower leg bone, so it rests right in the middle, and essentially acts as a shock absorber to provide support for the knee during activity, movement, and sporting events. So let's dive right in. Now these tests, signs and symptoms we're going to go over, they're the same exact ones that if you were to go into see an orthopedic surgeon, it's going to be the same stuff. We designed this video so you can kind of get a glimpse at home with what you may or may not be dealing with. All right, so let's start off with the mechanism of injury, also known as the MOI. There are two types. We can have an acute event, which is just basically a singular event that occurs, or it can be degenerative, something that takes place over a longer period of time. For the purposes of this video, let's talk exclusively about that acute event, a specific time that it happens. All right, and this is a very common attribute of a meniscus tear. So if this is something that did not happen, in one specific event, chances decrease a little bit that it is a meniscus tear. If it's something that develops slowly over a longer period of time, could be degenerative, but different story. We're not going to dive into that in this video. So with these acute events, typically it is a landing or twisting type of an injury that may or may not be associated with a pop or a click. All right, and very often, soon after this event occurs, there's going to be a ton of swelling, stiffness, and pain. It's going to be very difficult to use and move that leg. All right, next up are the signs. So very often an athlete will be able to point to a specific spot right on the knee where they feel their pain is localized to. Very often there's going to be continued swelling, stiffness, a lot of pain. And another common complaint is a sensation of their knee giving way. Essentially, it's just buckling underneath them. And then lastly, very often they're going to have pain with things like squatting and stairs. Okay, very key points all associated with meniscus tears. All right, next up is joint line tenderness. So here's what you want to do. Make a C shape with your hand. Place it right underneath the kneecap, and this is the joint line. Where my index finger is here and where my thumb is here are associated with the lateral and the medial meniscus. So basically you'll feel some ridges where the tibia, the lower leg shin bone, and the femur come down too. You'll feel ridges on each side, and right in between is going to be the medial and lateral portions of the meniscus. So what you want to do is find that joint line and just push around, poke around, inside and outside. Find it on the good leg, the other leg, and I want you to compare side to side. Any increased sensitivity, any increased pain on the symptomatic side would be considered positive for a joint line tenderness test. All right, next up would be end range pain. So end range meaning full straightening and full bending. So here's what you want to do. You need a towel roll or maybe like a foam roller, maybe folding up a pillow in half, but you want something underneath the far end of your lower leg. So your leg may be stuck in a little bit of flexion or bending just like this, and it may be really painful for you to try to straighten it out just like so. That would be a positive test. If you're able to get the ankle up there and it feels okay, then what you want to do is above the kneecap, apply a little bit of downward pressure with your hands to put the leg into further hyperextension. Increased pain with this test would indicate a positive test. And then likewise, just in the other direction, if you were to bend the knee, flex the knee to its max end range, if you get pain, increased pain or sensitivity with that movement, that's also going to be a positive test. Something you want to consider with these two especially, and this kind of goes with all the tests, is the swelling. The swelling, as you know, can occur with many different types of knee injuries, not just meniscus injuries. All right, and so what that means is that the swelling could be present from another injury, but could cause some of these tests to be positive, especially the end range ones when you're really forcing your knee into full straightening or full bending. All right, so then we have the very last test I want you guys to do at home. So for this one, you're gonna stand up, face a countertop, or just have something close by to hang on to. You're gonna stand on your injured leg, you're gonna bend the knee slightly, and then you're gonna try to rotate as far as you can in each direction at least 3 times, all right? Trying to get as far as you can each direction. Any reproduction of your pain or increased symptoms or painful popping, clicking is considered a positive test. Now, I mentioned at the beginning of the video that if you guys were to stick around to the end, I'll give you my recommendations on what to do if you were diagnosed with a meniscus tear, it's positive on MRI, and people, meaning some doctors and surgeons and specialists, are starting to recommend surgery. What do? Well, that is a very tough call to make, but I want to give you some insight into what I've experienced with a lot of my patients. I spent a lot of time around orthopedic surgeons, around knee surgeons, knee specialists, and I've treated hundreds of meniscus patients that have both been after meniscus surgery and not having it done whatsoever. So I guess the first thing to go over is that there are 2 types of surgery. There's what's called a meniscectomy, and that's your classic knee scope, and then there's what's called a meniscus repair. So those are the 2 main types. The meniscectomy, that is essentially one where they go in via arthroscope and they trim out or remove any irregularities, and they kind of just remove meniscus tissue. They remove the damaged area. So all that's done there is removal of meniscus, and the meniscus does not regrow. Important to keep in mind. The other one is called a meniscus repair. That is more for typically a younger population. It's more for individuals that have the type of tear where it's just a nice, easily stitchable tear. Think like a trench versus like a crater would not be very easy to stitch. So it depends on the type of tear and the tear location. Now, both are not great surgeries to do. However, if you have the opportunity to elect a meniscus repair over meniscectomy, it's one you definitely, in my opinion, would want to do. The meniscectomy is a shorter recovery period. Oftentimes you can get back to activity 4 to 8 weeks, depends on a lot of situations. The meniscus repair can be 6 months plus. However, the meniscus repair, they're not removing anything. All right, remember what I said at the beginning of the video, the meniscus is a shock absorber. And if you're removing your shock absorber, as time goes on, you're going to have less cushion for your knee. And so folks that have a meniscectomy earlier age, they tend to have a higher likelihood of needing something like a knee replacement or something more extensive down the road versus those that have a meniscus repair. So if you had to choose, go with the meniscus repair, but ultimately my opinion is that try to avoid surgery as much as humanly possible. I've seen hundreds of folks after a meniscectomy, after meniscus repair, they're not happy. I mean, especially the meniscectomy, you may feel good for a couple of weeks, months, maybe years, but it can really disrupt, your livelihood and really interfere with how good you feel and how well you can perform different activities. So what I recommend is try to hold off on surgery and try a conservative route. Even if you had a big event where there's a lot of swelling and you're positive on MRI, I've seen so many cases of athletes that is the case, and they worked conservatively through it, and 6 months, sometimes sooner, sometimes it takes a year, they're able to get back to doing full activity with no pain whatsoever, which is pretty incredible. And then, without having surgery, then you're decreasing surgical risks, and also you're decreasing the chance down the road that you're going to need some kind of further intervention or something to, get you out of all that pain that you're experiencing. A great example, I'll give you a quick story, has to do with my mom. She suffered a meniscus tear when she was about 60 years old. And she's very active. She's a runner. She is a referee for lacrosse, field hockey at the collegiate level. She's a spin instructor, very active individual, but her passion is running. She had the meniscus tear. She had tons of swelling. She was told by several orthopedic specialists to get surgery. And she wanted to chat with me first. I talked with her. I kind of chatted about all of the signs and symptoms she was experiencing, and she was positive for nearly every single test that I discussed earlier. But we elected to try a conservative route first. And about a year, it took some time, but about a year and a half later, she is able to run pain-free. She's 65 now, 5 years later, pain-free. She's able to run, no issues, with her knees. She did not have surgery, and she's crushing it. She's a great example of someone that had every sign and symptom in the book. She was told by several specialists to have surgery done, but she didn't want surgery. There's the risk, but there's so many other factors, especially from a degeneration standpoint, that occurs because of surgery, and she's crushing it right now. So that's one specific case. You cannot relate that to really anyone else. It's just a little case, but it's just something to think about. I always recommend multiple opinions, and I always recommend getting that conservative route first and really giving it the time that it needs, especially if you're an athlete and you want to continue to be active long term. Surgery may not be the best option. Some cases it definitely is, but it's just not always something you want to jump to immediately. One last point I want to bring up is that meniscus tears are pretty dang common, believe it or not. And very often they show up in MRIs and imaging of asymptomatic individuals, meaning people that have no pain at all. They can have a meniscus tear that may be present on MRI. So considering that, especially if you have an injury and then you go in and get an MRI and they see a meniscus tear, it may be hard for them to tell if that meniscus tear is due to, or related to, I should say, the pain that you're experiencing, or if that's something that was there previously. Okay, so meniscus tears is kind of like gray hair or getting fat. Happens as you age. I'm just kidding, but it is kind of like gray hair. Typically everyone gets it at some extent or another at different points in their life, but it's the full picture you have to take into account. And like I said, always, always, always elect for conservative measures first if you have that option. So thanks for sticking around, guys. If this video brought any value to your life, please, please, please hit that like button. If you have any questions or if you enjoyed this video, make sure to comment below. That's it for today. See y'all next time.